Hi, welcome to the CPAPstore.ca. Today we're just going to run through the Philips DreamStation 2. Just look at some of the menu options that you can expect when you open it right out of the box here. So we have the last session report. That's going to be kind of your home menu area. If we click settings, we can see these menu here. So we have the comfort settings and the device settings as well. So for comfort, we have tube. It comes with the standard 15 mil tube. It does not come with heated hosing. However, you can get heated hosing. It costs about $75 to $100. So for this, we have the 15 mil. You can click that, select to whatever you have. We have devices here. Airplane mode. Airplane mode will turn on and off basically the wireless connectivity of this device. So if you're on an airplane, you want to turn that on. Bluetooth. This can be paired to your device just so you can track your sleep better. Scrolling down, we have some device, information. Probably is meaningless to most people for a majority of the time. Click back and we go back to the last session report. Now, depending on your physician, you might have more setting options in here. That depends on your sleep therapist, what options they want to give you. So I'm going to go into the provider menu right now. You should not go into this area unless you are instructed, but let's go check that out. You're going to click this. It's going to blink and just swipe down like that. And here we are in the provider settings. Again, this is something that your sleep therapist should be controlling and not you, but let's go through the settings. So we have mode here. This can go between auto and CPAP. The pressure. This will be kind of like your prescribed pressure. That will be changed by your physician. The flex, 1, 2, 3, and off. Flex is the amount that the air pressure will adjust as you exhale. So with a bigger breath or a smaller breath, and you know how your breathing might fluctuate throughout the night, the pressure is going to change. So 3 is a higher exhalation relief, whereas 1 is a lower. Moving down, again, tube size, and you're going to have your ramp pressure here. So let's click 30 minutes. And then we have the starting pressure. So if your pressure is 10 as your prescribed pressure, you might want to start at 4 or you might want to start at 6. Scroll down one more time. Patient access. So we got the patient controls and patient data. We'll talk about that in 1 second. And then we have easy start, CPAP check, and mask type. So different types of mask settings you have there. And then you have some different auto trial settings here. Again, all of this stuff should be done by your sleep therapist. However, your sleep therapist might allow you to have access to some of these settings. So they might turn on this, and they might turn on this. So if we go back to the normal menu and not the provider control center, then we go to settings, and you will see a little more settings here. This is what we saw in the provider control center, but now the patient has access to this. So you might see this when your provider gives you the CPAP machine. You might see this straight out of the box. So we have the ramp. Again, the time of the ramp, your starting pressure, confirm, humidity level, 3 is always good, tube size, and flex. We already talked about flex. And then the normal device stuff that we already went over. Okay. Now, like we didn't see before, now we have view report because we clicked the patient data. Now we can see the patient data. So for 1 day, 7 day, 30 days, for example, 9 days, you can click and it'll tell you the days used and usage hours, stuff like that. You can get more information through the app. To turn on your CPAP and begin CPAP therapy, I don't have a mask connected, but I'll still show you. Click this button. And it starts going. Humidity, you can cycle through. Ramp, we can change the pressure. To end sleep app therapy, click that button there. So that's the DreamStation 2. Visit us at thecpapstore.ca.